Hey, what's up everybody? It's Neil Holmes here from the WoRX, and today I want to talk to you about insurance, the good and the bad parts about health insurance. So, the good parts about health insurance. These are all the things that you already know. Your health insurance, anytime you need to see the doctor, if you have those prescriptions, if you need to see a specialist, it all depends on what plan that you have. You know that you've got those things covered in case of any emergencies or being ill, sick, or any of those things. But let me tell you the bad part about insurance and how this works out with pain. So let's just say you've got some back pain here. So what do you typically do? You would typically go see your doctor if it doesn't go away, and your doctor is going to generally prescribe you with a couple of, prescriptions. I call it's a cocktail of 3 prescriptions. You usually will get a muscle relaxer, an anti-inflammatory, and then some sort of painkiller. After you go through and you use up that script and the problem is still not gone, that's when you get referred to physical therapy. So here is the bad part when it comes to insurance, especially when you think of things like physical therapy. Let's just say insurance approved 12 sessions of physical therapy. So you're supposed to go 3 times a week for 4 weeks, and that's the 12 sessions. Now, here's something I want you to think about. Is there any incentive from the physical therapy office to get you better before those 12 sessions are up? And no, the answer is no. Because why would they? If you've got 12 sessions approved from insurance, then they're going to use all 12 sessions. And many of you who've already had and gone down this route for physical therapy for things like back pain, what happens is after your 12 sessions are up, then they tell you go back to your doctor and get another script for more physical therapy. So that's what you do. It's back to the doctor, you get another script, it gets approved again, and so here you are, you're back to physical therapy for another 12 sessions. And here we go again, same thing applies. Is there any incentive for them to get you better before your 12 sessions are up or your second round of 12 sessions are up? And the answer is no, because it's already been approved. There are a lot of clinics. This is their system. They have a very cookie cutter approach to where you're just going to go and do these small incremental things for each session. And for those of you who've been through physical therapy, you know what I'm talking about. Now, physical therapy is 100% necessary for things like, after surgery, to rebuild stuff. But when it comes to just soft tissue pain, that would be pain in your back, if it's pain in your neck, in between the shoulder blades, they're really focusing on where it hurts. And if you saw one of my last videos, where you feel it and where it starts are 2 different places. And so back to the insurance part. There's no incentive to get you any better because you represent the assembly line that feeds the clinic as you keep coming in. That's the bad part about insurance. Now, over here at the WoRX, we don't accept any insurance. We are all out of pocket. Reason being is that, number one, insurance doesn't think that what we do is medically necessary. However, if you still have pain from massage and chiropractic and physical therapy and getting shots and doing yoga and icing and acupuncture and all of those things, if you still have pain, it's more likely because it's something muscular that nobody has looked for yet, because where you feel it and where it starts are in 2 different places. So because we don't take any insurance, we have all the incentive to get you a result feeling better in the very first session. Because if we don't, then why would you continue paying out of pocket here with us? So our job is to solve this problem as fast as possible, looking for where your problem is actually starting instead of where you feel it. And so let me give you an example. So I've had countless patients who've come in for low back pain after physical therapy, and everything that they've showed me, I'm like, show me what you did. What do they have you doing? Between the exercises and then the stretches, I look at all of those and I go, all that's doing is making the problem worse. Because here's the thing, if you're feeling the pain here and you're going through exercises and stretches for these areas, then all you're doing is making the problem worse. What do I mean by that? In my world, we're always looking for where the problem starts, not where you feel it. And so typically, if you've got low back pain, then this problem starts in through the glutes. This is the first place that I'll look. And so if you're doing lunges, if you're doing any like crab crawls, or if you're doing anything related to this area and strengthening it, all you're doing is strengthening a tight muscle. What does that do? It just pulls even tighter. So then it makes this problem worse. So here at the WoRX, this is why we reverse engineer pain patterns, because these problems that you come in with, they've usually been made worse by doing exercises to strengthen these areas. Let me give you an example. So I just recently had a patient who came in after they went through their 24 sessions of physical therapy for their low back pain. And after she described to me all of the exercises and motions that she was doing at each session, all I could think about was, all of these exercises are making this problem worse. And so because we don't focus on where the pain actually is, this section right here for this patient is what was too tight. And when it's too tight, it pulls everything down, and then you feel the strain through here. So once I identified this on the very first session and then worked through that, it gave her 75% relief just in the first session. And it only took a few more to then clear this problem up. See, that's the difference. Because we don't take insurance, we have to figure out where this problem starts immediately. Otherwise, why would you continue to keep seeing us? So there's my rant. That's the difference. That's the good and the bad, mainly the bad part about insurance, is that where you feel it and where it starts are two different places. And if you continue to just work on where you feel it, you never solve the problem. If you're seeing an insurance provider who's in your network that you've been approved for, then they'll continue to work on where it hurts and nothing will change. So guys, if you are looking to solve that problem that you still can't, please go online at theworx.com for more information, or give us a call at 941-981-0880. Thanks.